Hi, I'd like to introduce myself, Claudia Corsell, Clinical Director for Community Health Centers of the Rutland Region, and my co-presenter, Tracy Upton, Quality Manager, Community Health Centers of the Rutland Region as well. Community Health Centers of the Rutland Region is a federally qualified health center located in the southern mid-central section of the state of Vermont. We have practices in several areas. They would include Brandon, Castleton, Rutland, Shoreham, and West Pollitt, Vermont. We have approximately 45,000 active patients within our practices. Our goals really are to serve patients in a vast array of services, which include child care, acute care, preventative care, management of chronic illness, behavioral health, and pediatrics. Our practices are open 7 days a week, especially through our Express Care Services, which are located at the Rutland and Castleton practices. We provide medication-assisted treatment, which is a program that we're very, very proud of. Our goal in this program is to provide services for our patients within the primary care practice that required medication-assisted treatment. For this service, we've been well recognized as well. Patients are very happy to receive their MAT services within the practice with a PCP who they're close to and who manages their medical problems. We also have behavioral health embedded within all of our practices. This has been a great service, and our patients can get the right care with their providers in behavioral health as well as see their primary care providers. We also provide services within our local skilled nursing facilities. There are 3. We have embedded nurse practitioners within all of those facilities who are supported by care coordinators. We have physicians that go into the practices as well. We provide acute care for those patients, so whenever they need help, we're there to support them, and our physicians can go in and provide our regulatory visits and do the admissions and discharges for those patients as well. Our care management program is really something that we love to boast about. We've been in existence for about 8 years, starting out with a single care manager at our Castleton practice. We have grown to an organization with well over 20 care managers, with 2 to 3 care managers on average in each site. We also have a community health worker within 2 of the practices. These community health workers help patients who require more social service, social work services, the type of things that you might see when you're homeless, may not have money for food, housing issues, and general transportation. Our care management program really works with those patients that are very complex and who also have social determinants of health concerns. The social determinants of health have really proven to impact how patients will manage their care medically. We also look at recent hospitalizations, ER visits, and really work closely with our patients to ensure that if they're seeing a specialist or going to a facility outside the organization or in another part of the state, that we could tie all the pieces together and have proper transitions of care. This is very important for our patients, especially for those that are challenged in what they need to do for next steps. Patients can be very concerned about medication changes, dosing, names, what they should take, what they shouldn't take, and changes that are made as they transition through the system.
It's really important that we identify care managers as part of the healthcare team in order to meet the goals and outcomes that we have for our patients. Care managers can receive a referral from anyone in the healthcare team, whether it be a provider or a nurse. They can also receive referrals from outside stakeholders, such as community agencies, from a provider specialist office, or also from a hospital-based inpatient care team. It's really important that we continue to assist patients across all levels. In 2018, we served close to 4,000 patients in care management, and of those patients, there were over 14,000, close to 15,000 individual encounters for those patients. As you can see on the slide, care management engages with patients certainly on different levels depending on the needs of the patient. The majority of our patients, 82%, only needed to have an engagement with care management for 5 or fewer encounters. However, we do have a subset of patients, 10%, that actually need extensive and more care management than the rest of the population. And those patients received 10 or more encounters in 2018 with the care managers. Some of those patients receiving up to 40 or 50 separate encounters with a care manager. Through the first few months of 2019, through July of 2019, we have served just over 3,000 patients and just over 10,000 care management encounters. Our community-wide collaborative is recognized on a state level for the amount of collaboration that we do between stakeholders, where the Rutland Health Service Area has been upheld as a model of collaboration in the state. We have several stakeholders that meet on a monthly basis to discuss population health within the community, to set goals for the health of our community. In 2019, our major collaborative goal is to decrease the incidence of sepsis in the Rutland community and decrease the number of readmissions for patients who were diagnosed with sepsis. In the past, our initiatives have included CHF and COPD readmission rates, and we've made great strides in reducing the amount of readmissions for these patients. Care managers are very integral in our community-wide collaborative, and they communicate and collaborate with the hospital-based case managers to ensure a safe transition to the home and to reduce the number of readmissions for these patients.
In summary, Community Health Centers of the Rutland region provides very high-level care management to all the patients in our community. No matter what the situation, we're there to support them through their transitions of care. We have very high-level relationships with community partners. We have ongoing collaboration with case management at the hospital and at skilled nurse facilities and with other stakeholders in the community. Patients are very appreciative of the services that we provide, and our goal is to continue to improve our program, focus on how we can improve transitions throughout the state and also with neighboring states, because many of our patients go to healthcare facilities in neighboring states as well, and be there for them during the times that they really require our services. We'd like to thank you for this opportunity in discussing community health centers and our care management program.